Hi, we are Team C, and our topic is about healthcare product ethics. According to a survey from Hong Kong Health Food Association in 2014, there are a growing number of consumers start trying healthcare products. In that survey, people report a need for separate supervision on healthcare products from normal food, but seldom of them have knowledge on healthcare product labeling system. This raised our interest on exploring in healthcare product market what its current situation and what regulations are established with potential ethic issues. Healthcare products are defined as those substances which gives energy or makes a person healthy. Sometimes young people tend to say healthcare products are for our grandparents, not us. But according to related survey, it shows that healthcare products are no longer exclusive to the elderly. Here two figures shows different preference for different age groups. Here we introduce a survey from China Consumers Association to know more about people's awareness on the healthcare products. This is a random sample survey and 63% of them are male. The age group was mainly from young people aging 18 to 35 years old. Over a half of the sample have bought healthcare products, but most of them didn't have thorough knowledge about these products. Here are two statistics data. The conclusion is that most people get information about healthcare products from TV advertisement or internet, and function and safety are two most concerned factors when they buy healthcare products. When the question became main function of healthcare products, general consensus was that the main role of healthcare products is to regulate the function of the body. But when it comes to choosing detailed function belonging to healthcare products, most people is ambiguous for those claimed functions.
This part is about healthcare products on the money side. Globally, the healthcare spending is projected to increase at an annual rate of 5.4% in starting from 18 to 22. It's a considerable rise from 2.9% from 13 to 17. This increase reflects the strengthening of the dollar against the euro and other currencies, the expansion of healthcare coverage in developing markets, the growing care needs of elderly populations, advances in treatments and health technologies, and rising healthcare labor costs. One thing we need to know is the NCDs, which refers to cancer, heart disease, and diabetes. It accounts to 71% of 56.9 million deaths reported worldwide in 2016. That shares increasing amount of percentage over 80% in the developed markets. The NCD's rise in both developed and developing markets is fueled by the urbanization, sedentary lifestyles, changing diets, and rising obesity levels. One thing we need to point out is the emergency medicine that is very close to the heart disease. For example, the acute myocardial infarction. It is a common cause of death. Most of the deaths are due to the fibrillation occurring soon after the onset of this kind of sudden heart. Once the patient reaches the hospital, the major aim of treatment is to decrease the size of the infarct. One common treatment is to take aspirin. All patients are expected to take a powerful anticipated drug with the rapid effects, which could reduce the mortality by 20%. For aspirin, it has several dosage forms and strengths ranging from 80 to 500 mg. It is listed as OTC, which is over-the-counter regulated pathways. There's a lot of research from industry and literature discussing the different powerful aspects of aspirin.
Okay, so I would like to introduce some ethical issues of vitamin supplement products. And as we all know that vitamin supplement products are important to us and are regulated by FDA as part of dietary supplements. And the first ethical issue is in pharmacy practice. Many pharmacists are ill-equipped to counsel patients about these products, and they're also overusing and misusing issues. For example, some ingredients are also added to a growing number of foods, including breakfast cereals and beverages. As a result, you may take in too much of vitamins than you expected. and too much vitamin A can cause headaches and liver damage, reduce bone strength, and cause birth defects. And many dietary supplements have not been well tested for a group of people such as pregnant women. And for the efficacy of these products, a large number of products have no or inadequate data to support the use of them. And there are also misleading claims and advertisements. For example, they may claim to have a treatment or mitigate and diagnose some disease. There are also uninformed potential risks and side effects of vitamin products. For example, for people taking too many vitamin products in combination, they may have some safety issues. And for people taking these products instead of medicines, they may not really cure the disease. And for the people who are getting cancer treatment, they may have side effects stemming from using vitamin supplement products. Okay, so Shem.
Yeah, so in this part, I'm going to talk about the ethical issues surrounding skincare tone products in Africa. So to start with, I'll share the story of Taiwo. So Taiwo is a 32-year-old Nigerian woman who believes that bleaching her skin is going to give her a better life. So she has spent the last 15 years using her small salary to be able to become lighter. And after 15 years, she feels she's more beautiful and more confident. Here we see that 77% of women in Nigeria, for instance, use skincare product, lightening product, believing that having a lighter skin equals a better life. 59% of these people are in Togo, 25% of them are in Mali, and between 52 to 67% of them are in Senegal. But this is not just an African issue. According to the World Health Organization's report, 40% of women in China and 61% of women in India also use skin lightening creams. But to further buttress how important this issue is, to further buttress how important this issue is, in 2017, $4.8 billion was used in this industry, and it is projected that it's going to grow to $8.9 billion by 2027. So it means that a lot of the large pharmaceutical companies are playing in this industry. Here, a lot of research has also shown that women with lighter skin get better treatment, and this has actually fueled the need for Black women to believe that having a lighter skin indeed equals a lighter life. So a lot of research has gone into this, and one of them to highlight is the fact that in 2011, it was shown that light-skinned women got shorter prison sentence than black-skinned women. Here, why are we discussing the ethical regulations behind this? We're discussing the regulations behind it because in Africa, for instance, roadside vendors sell plastic tubes and ointment in cardboard papers without even labels on them, without even showing the ingredients that were used to make this product. And then also the large pharmaceutical companies flood the low-income markets with a lot of these products, claiming that they will actually change skin colors from a darker shade to a lighter stage, to a lighter shade without even showing the side effects. And we know that there's a lot of research that has shown that this actually causes the high risks of skin cancer.
So on. So there are many reasons for using healthcare products. We want to be healthier. More beautiful. Someone with incurable disease may want to try to use them to alleviate the symptoms. In short, there is a market. Take the dietary supplement for an example. The market was valued more than 100 billion in 2008. Not just for America, the economic effect is all over the world and growing rapidly. And although the definition of healthcare products is still not clear enough, so take the dietary supplement for an example. It's different from food and drugs. Dietary supplements are not intended to cure or treat disease, and about the scientific evidence and the effectiveness, we don't know as much as what we know about drugs. Here are the regulations in China and the US about drugs and dietary supplement. To make an analogy, like this spectrum, most of the healthcare products are in the gray area between rigorous treatment and normal products, according to effectiveness, our knowledge about it, and the regulation. So in Hong Kong, there is the same concept
called dietary supplement. Instead, we use different, like the regulation for drugs to regulate those contain Western drugs ingredient, and Chinese medicine ordinance to regulate those made by Chinese medicine, and all the other food, no matter whether it has an effectiveness, it will be treated as general food. So compared to mainland China, it only covers a small subset. Some of the rest are strictly regulated, while most of the other are loosely regulated as general food. Here are some issues from various stakeholders in healthcare industry. For the manufacturers, traders, and advertisement, there are already existing regulations on them. We just need strict supervision and timely regulation. Like in this February, FDA planned to strengthen the regulation on the dietary supplement, and some user may misuse those products for lack of the understanding, which require reasonable guidance and science popularization. And to regulate the expression of health-related function will also help, like what Chinese government did in this March. They redefined 18 specific functions, and the products can only be promoted with those expressions. With the expression, it will be possible to add a functional label, like the nutrition label, with the quantitative clinical trial evidence to make sure the effectiveness and the risk it will lead to human body. And there are also a voice that it may kill many companies as it's too strict. For new coming products, we do need a flexible regulation. One inspiration is like what Hong Kong government did for some Chinese medicine. They can apply for a transitional registration before they get formally registered.